Okay, so we have here the DIC. DIC stands for your Disseminated Intravascular Coagulopathy. So basically, this one is not a disorder. It's more of the complication of your existing na mga systemic disorders or even related to your bacterial infections. Again, your DIC is just the consequence or the complication of your other existing na mga medical conditions. This is not the primary infection or the primary na disorder. So, complication lang ito. So, it might be related to your chronic DIC, related to your vascular tumor, tissue necrosis, kidney disease, liver disease, or even associated with your cancer or malignancy. Related to your cancer of the prostate, cancer of your pancreas, cancer of your ovary, then we have also your lungs, and other disorder like your myeloproliferative disorders and even your multiple myeloma. This also may be related here to your to your acute DIC related to your intravascular hemolysis, septicemia. We have also here your um, severe burns, cardiovascular diseases, and we have also here your crash injuries. Okay, now we have here the mechanism of your disseminated intravascular coagulopathy. So disseminated intravascular coagulopathy here characterized by consumptive coagulopathy. So it try to consume basically your platelets and other components of your coagulations. Okay, so we start here with your DIC because of other existing medical conditions. What you have here would be overactivation, resulting to your overactivation of your thrombin. So because of that, your thrombin, normally your thrombin is being used to convert your fibrinogen to your fibrin clot, which eventually converting that one to your fibrin monomer, dimer, to your polymer, and finally, magkakaroon ka ng clot, stable clot by cross-linking by your factor 13. But in the case of your DIC, ang nangyari dito ay since overactivation ng ating thrombin, so your fibrinogen will be converted to your fibrin monomer, okay, and that would only be up to that one. It will no longer be able to be converted to your fibrin dimer or even polymer. And of course, wala ka ding cross-link na fibrin polymer with that. And therefore, dadami ang ating fibrin monomer which circulate in our blood circulation as insoluble na fibrin monomer. This insoluble fibrin monomer will eventually try to coat here your platelets or even coagulation factors, and that's result here to the clotting process because of that. Another one, normally, if you have your fibrin clot na stabilized, polymerized by factor 13, that would eventually be dissolved by our plasmin. So fibrin clot will be dissolved, hydrolyzed by our plasmin, converting that one to your fibrin degradation products, and what you have for that would be small concentration ng X fragment, Y fragment, and even your D dimer. But in a case, and that actually your plasmin will just try to dissolve your clot only mga localized na clot na na-form lang. But in the case of your DIC, sobrang activated din ng ating plasmin wherein it try to dissolve all the fibrinogen or the fibrin clot form throughout your body. And therefore, since madami ang na-dissolve na clot, madami ka ding mga products. X fragment, Y fragment, and D dimer. D dimer is basic, ito yung pinakaano natin, products ng DIC. If you form here, madaming D dimer, increased concentration ng D dimer, that would be related to your DIC. And therefore, once you have already formed na madaming clot, what's going to happen here, your platelets will be entrapped within your fibrin clot. So pag na-trap sila sa fibrin clot, your platelets will be consumed. Kaya tinatawag siyang coagulopathy, consumptive coagulopathy because of that. And therefore, resulting to the destruction of our platelets. At bababa, and eventually bababa ang platelet count natin that become here your thrombocytopenia. Okay, then another one, regulatory control proteins or protein S, protein C, protein Z. We try to control here the clotting process also being destroyed and therefore affecting also here our clotting process. Okay, we have here the reason as a summary for the entire process of the bleeding manifestation ng patient na may DIC. The first one, overactivation of your plasmin. Okay, another one, we have your thrombocytopenia because of your entrapment of your platelets within your fibrin clot. So, bababang platelet count, so the patient would have here the bleeding tendency. Decreased regulatory control proteins would have your thrombotic tendency. We have also here increased circulating plasmin. So, that's also have the over bleeding manifestation. Actually, overactivation of your plasmin. Okay, overactivation of your no plasmin, but rather thrombin. Okay, so what you have here would eventually clotting process. So it's a combination of your clotting and the bleeding process. Number one is more clotting. Number two is your bleeding manifestation. Number three would also be clotting process. And number four would also be that's related to your bleeding manifestation. Okay, then we have also here the laboratory test to diagnose here our DIC. So we have here the PT and PTT are prolonged because of the destruction of your coagulation factors. And we have also here your platelet count. So mayroon tayong thrombocytopenia. Expect here that the platelet count would be less than 50,000. Another one, we have the D-dimer. Again, this is the most sensitive test parameter for you then to diagnose the IC. So, dapat mataas ang level ng D-dimer natin. Okay, normal values for the D-dimer, 0 to 220, 0 to 240 nanogram per ml. That's nanogram per ml. In the DIC, this one could go as high as 10,000 to 20,000. Another one, fibrinogen. Okay, the normal values of your fibrinogen is 220 to 498 mg per dl. In the case of your DIC, okay, that's less than 220. Okay, because of the madaming fibrinogen will be converted to your fibrin clot. In the case of your more than 498 mg per dl, that could be seen here in our inflammatory reactions, and even a severe liver disease or even a pregnancy. Okay, peripheral blood smear the patients. Majority of the RBC, almost 50% of that, are eventually in the form of the schistocytes. Okay, we have here other tests. So we have your fibrin degradation products, more than 10 microgram per ml, but currently hindi siya maginagamit na. Usually, we rely on the quantitative na D-dimer na test. So what I have mentioned, ang ating D-dimer considered to be the most specific na parameter for us then to diagnose the DIC. Soluble fibrin monomer is positive for that because again, ang ating fibrin monomer is not being converted to your dimer even with your polymer, hindi siya nagko-cross-link in our DIC. Your protein C, protein S, protein Z, antithrombin, which are your regulatory control protein, which are eventually being destroyed, and therefore, 50% ng kanyang, less than 50% ng kanilang activity. Plasminogen, TPA, again, those are needed for the clot dissolution. Okay, so mababa din ang level natin. And therefore, pag ninag-clot, so that's more of thrombus formation. Thrombus marker, so positive siya sa thrombus marker because thrombosis din ito. Okay, that's prothrombin fragments 1 plus 2, antithrombin, okay, which are the markers for the thrombosis. Okay, are eventually also increased because again, may thrombotic tendency ang ating DIC. Another one, thrombin time, reptinase time also increase. So, mga parameters natin dito is combination of thrombotic sa bleeding tendency. Okay, now we go to the treatment of your DIC. So, number one, supportive therapy. Mas supportive lang, so mean to say whatever the signs, symptoms, if the patient would have a fever, so bigyan mo siya ng antipyrogenic. Okay, so, ganun. Pag dehydrated ng patient, gives an adequate hydration, rehydration. So, ganun siya. So, pag may severe bleeding manifestation, you can give fresh frozen plasma because your plasma, again, contains all coagulation factors. It could help to stop the bleeding process. You can also give the PCC or prothrombin complex concentrate. Another one, you could also give the factor VIII concentrate or even the platelet concentrate. Again, if the patient would have already the bleeding manifestation. Okay, the next one, we have your liver disease coagulopathy. So, these are the condition here wherein you have a bleeding manifestation if the patient would have problem with the liver. Or the bleeding disorder related with the liver problem could be in the form of your generalized or localized Could also be mucocutaneous or even anatomic. Okay, so these are the reason why you have a bleeding manifestation if you have a liver disease. The first one, the patient tried to suffer here with your vitamin K dependent coagulation factor deficiency. Your vitamin K dependent coagulation factors includes your factor 2, 7, 9, 10, protein S, protein C, and the protein Z. Of all your vitamin K dependent coagulation factors, factor 7 is the first to be decreased because siya yung konti lang na half-life. Usually after 6 hours, mag-decrease na kanyang concentration. And therefore, since your factor 7, this is belongs to your extrinsic pathway, ang pinaka-sensitive na test natin, coagulation test, that would help you diagnose if you have vitamin K-dependent coagulation factor problem would be your prothrombin time. Again, bakit prothrombin time? Again, it's because here that your factor 7 belongs to your extrinsic pathway. Since of all your vitamin K-dependent coagulation factors, factor 7 would have the shorter half-life. And pag bumaba na siya, related to your liver problem, since hindi niya produce ng because you have problem with the liver, and therefore hindi siya nakapag-produce ng mga coagulation factors which are your vitamin K dependent coagulation factors. The first na maapektuhan nito is your factor 7, and that could be monitored here by the PT or prothrombin time. Another one, factor 5 deficiency. Okay, the factor 5 deficiency would separate your liver disease with your vitamin K dependent coagulation factors deficiency. Pag vitamin K dependent coagulation factor deficiency lang, so ito lang problem natin. But if you talk about your liver disease, so this one includes, pag liver disease, it includes here your vitamin K dependent coagulation factor problem plus your factor 5, ang ating disorder. So what separate here, your liver disease and your vitamin K dependent coagulation factors would be your factor 5 deficiency plus meron siyang factor 5 deficiency pag liver disease. So, liver disease is vitamin K dependent coagulation factor deficiency plus factor 5 deficiency. Pero pag vitamin K dependent coagulation factor deficiency lang, so ito lang siya, wala kang factor 5 deficiency. Pero pag liver disease ulit, ito saka ito. Another one, the liver disease will result also here to the decreased production of your fibrinogen because fibrinogen is also being produced by our liver. It could go as low here, less than 200 mg per dl because normal values natin ng fibrinogen is 220 to 498 mg per dl. So, liver disease would also result here to the less than 220 mg per dl na fibrinogen. Platelet count is also decreased. In the liver disease, it could go as low as less than 150,000. Okay, we have here the treatment for the liver disease. Number one, so if the patient with a problem with a vitamin K dependent coagulation factor deficiency, you can give a vitamin K. So vitamin K could be given oral or IV. So between the two, mas mabilis, especially kung sobrang bleeding ng patient natin related to your vitamin K dependent coagulation factor deficiency, you give vitamin K in the form of the IV more than your oral. Kasi mabilis umepekto ang ating IV more than your oral. Another one, for the severe liver disease, so pwede ka nang magbigay ng plasma concentrate in the form of your fresh frozen plasma. Again, your fresh frozen plasma contains all coagulation factors and therefore could help here primarily to stop the bleeding related to your problem with the decreased production of your coagulation factors is because may damage ang liver ni patient natin. Usually, 2 units ang binibigay natin. Okay, then we have your fibrinogen deficiency. Sobrang baba ng fibrinogen. You can give your cryoprecipitate antihemophilic factor na concentrate. So basically, it's a blood component, blood unit na madami siyang fibrinogen concentration. It could help eventually solve your problem with your fibrinogen deficiency. Okay, now we go to the chronic renal failure. Chronic renal failure would also have a bleeding manifestation. And that might be nagkaroon sa chronic renal failure because meron siyang DIC or related to your DIC. Chronic renal failure resulting to your DIC. We have also here your hemolytic uremic syndrome and your thrombotic thrombocytopenic purpura. Bleeding manifestation with the liver disease, chronic liver disease associated with the following. Platelet destruction. So, wala kang coagulation factor problem. Okay, so usually, di ba, nagkaroon ka ng bleeding manifestation is either may problem ka sa primary or secondary hemostasis. But in the case of your chronic renal failure, the problem here, defects is on your platelets lang. Okay, nagkakaroon ka ng bleeding manifestation because problem with the platelets, not on your coagulation factors. Coagulation factors are normal in a chronic renal failure. So, bakit nagkakaroon ka ng platelet defects? Bakit mababa ang platelet count mo? It's because your platelets has been coated with the guanidinosuccinic acid and dialyzed phenolic compound pag nag-undergo ng dialysis ng patient natin kasi may renal failure, which eventually try to destroy your platelets. And therefore, nagkakaroon ka ng bleeding manifestation. And again, chronic renal failure, bleeding manifestations only related to problem with the platelets and not with your coagulation factors. Okay, another one, we have here your nephrotic syndrome. So nephrotic syndrome, it's basically because of the disruption in the electrical charges in our glomerular membrane, which eventually try to leak out all your coagulation factors. Actually, not only your coagulation factors ang lumalabas, but even your lipids and other amino acids and even your coagulation factors, which eventually resulting to the decrease concentration ni ating coagulation factors, which eventually results here to the bleeding manifestation. So, nag-leak out ng mga coagulation factors related to your nephrotic syndrome includes your factor 2, factor 7, 9, 10, 12, antithrombin, and protein C. And this nephrotic syndrome may be related to your problem like your SLE, your chronic glomerulonephritis, diabetic glomerulosclerosis, and we have also here your amyloidosis. Okay, so basically yung problem lang dito sa nephrotic syndrome natin is coagulation factors, walang platelet manifestation or it doesn't affect your platelets. Okay, and lastly, we have your vitamin K dependent coagulation factor deficiency. So that's problem related to your vitamin K dependent coagulation factors like factor 2, 7, 9, 10, protein C, protein S, protein Z. Okay, for the treatment, since kulang siya ng ating mga vitamin K dependent coagulation factors, then you give vitamin K dependent coagulation factors. Vitamin K is being given either by oral or IV. Pero pag severe bleeding manifestation because madami ang nawala because of those coagulation factors, then you could give a plasma to the patient in the form of your fresh frozen plasma. You could also give activated prothrombin complex concentrate. Or you could also give 4-factor prothrombin complex concentrate. Okay, so that's all about our coagulation factors. Okay, thank you.